I think all of us in the field of myeloma really struggle with the best way to manage these patients, particularly with CNS disease, just because we don't have a lot of great treatments. Though there is some data that's coming out that maybe some of the novel therapies are crossing the blood-brain barrier, but we don't really have any studies to really back us up on that. There's some case reports with daratumumab as well as pomalidomide, and then we know with selinexor that also crosses the blood-brain barrier as well. But we don't have any data on the efficacy as far as CNS disease. I think the also challenge with patients that are presenting with CNS disease is it can mimic other things. So if a patient's having new onset headaches or dizziness or neuropathy, trying to sort that out, like, are they having side effects from drug, or is this something we need to be concerned about? So I definitely think that in myeloma patients, you always have to have the thought, like, could this be CNS disease? I think with extramedullary disease, that's another challenge, particularly when patients have had extensive treatment, because then you're trying to find a good combination that potentially would help minimize that extramedullary disease. There's some data that is coming out with some of the newer drugs that are currently under investigation that maybe they might work with extramedullary disease. But again, I think we just need more data to come out. And the other thing with the data as far as extramedullary disease is the definition and making sure that when studies are reporting on extramedullary disease that we know exactly what type of extramedullary disease. So is it extraosseous or is it paraskeletal extramedullary disease? Because that's going to be an important differentiation both in terms of response but also the impact on survival. We know that those patients with extraosseous myeloma have a median survival of about 1.3 years from the time of onset of their disease. So I think that's challenging. And I think the most important challenge, though, is how do you have the discussions with your patients and letting them understand the impact of CNS disease or extramedullary disease and making sure that they're aware that they need to have those conversations with their families, that they need to be doing some advanced care planning so that they're prepared and then they're not taken back if something were to happen to their family members.